Here are some common questions that we generally get asked. What do the first few days feel like post-op? So, everybody varies, but generally your pain is quite good on day 1. You'll have a lot of pain relief on board and it'll be easy to do your exercises and get up and moving. Generally day 2 is a bit of a different story. Your pain and swelling starts to set in, so please don't be disheartened if you're finding it difficult to do your exercises. Remember to use the ice pack that you are provided with. Please continually ask if it needs to be topped up. We do not mind going to fetch you ice. People sometimes will experience some nausea and dizziness on the first day, but this will generally subside on day 2. Can I kneel after my knee replacement? Yes, you can. You'll not harm your prosthesis by kneeling, but it might be a little sore to kneel on a hard surface.
Do I have to sleep on my back afterwards? No, you don't. For a knee replacement, you're able to sleep however you're comfortable. The only thing to avoid is lying on your back with a pillow under your knee. If you spend too long with your knee bent, it will become very difficult to straighten your knee. For a hip replacement, you're able to sleep on your side. It will likely be painful to sleep on your operated side for a few weeks though. If you do choose to sleep on your non-operated side, you'll need to place a pillow between your knees to avoid your leg crossing the midline. Can I sit in my recliner chair? Yes, you can, as long as it's a good height and has armrests so you can get in and out of it safely. We recommend you elevate your leg at times for swelling control, but not to use the leg elevation on the chair so that your leg is not in a flex position all the time. Once again, measure your furniture heights so we know if it's going to be appropriate. How do I get in and out of a high or a low car? You may need to modify the way that you get in and out of the car after your surgery. It's best to often put your bottom in first and then swing your legs around. Ensure that you push the passenger seat back to give you more space to swing your legs in. We can practice this with you on the ward if needed and simulate if you've got any concerns.
My top tip before joint replacement surgery: please don't be afraid to ask the nurses for pain relief. The most important thing for you to do is to get up and walk and do your exercises. So you've got to have your pain relief on board to enable you to do this.
My top tip is if you're having hip replacement, don't forget to measure your furniture heights at home and record those for us. And don't forget to buy a long-handled reacher before you come into hospital.